Hello, this is Cindy. I'm doing my nursing assessment for 612 for the abdominal assessment. This is Miss Courtney, and she's assisting me today. So the first thing we want to do is we want to assess the abdomen. And so what we're doing is we're looking for color. Her stomach's not pale, it's pink, so we know that she's getting good blood flow to it. We're looking for symmetry. And we also look at that both sides are even, her respirations are unlabored. She's not using any abdominal muscles to try to breathe, so that's a good sign. We also look for any skin conditions. She does have eczema. I don't know if you can see it, so there are some red spots on her. And we also look for any masses or pulsations inside her stomach. And so just visually looking, she doesn't have any. So now we'll go ahead and we'll listen. We listen in all four quadrants, the right upper and lower and the left upper and lower. And so her bowel sounds are what we consider normal active. They're not too fast, not too slow. She's having anywhere from 10 to 15 gurgling noises within all four quadrants in a minute, so that is good. So now we're going to go ahead and listen to her arteries. So we're going to start right here by the umbilicus, and what that is going to be the aorta, and then her left and right iliac on each side, and left and right femoral. And we'll listen to those with the bell and the diaphragm. Alright, so everything was good there. We didn't hear any bruits over any of those spots. So the next thing we'll do is percussion, and same thing with auscultation. We percuss in all four quadrants to see if there's if they're tympanic or if there's dullness. And so we'll start. Alright, we also look at to see if we can hear anything over the organs. And so what we look for there is we do it over her spleen. We also check for her liver, and her gallbladder will be right up in that area, so we'll do the same thing. And what's confusing about these is they're located almost right up under the rib cages. And so what you do is we're going to percuss starting down here and up until we can hear the dullness, and then we need to do it in between each rib so that we can make sure that we're getting the right sound. We don't want to do it over the ribs. And then we'll measure the distance in between. Okay, so it's about right there. Alright, so we will measure that. And so here we're looking for anything between 4 and 7 centimeters. So she's about 5 centimeters, so we're good there. So we'll come over here. And what we look for here is right in the mid-axillary line to try to find it because of the position of the way the spleen is located. Alright, so next what we're going to do is palpate. So we're going to palpate in all four quadrants. Does everything feel okay there? Okay, so now we're going to do deep palpation. And here what we're checking for is any pain, tenderness, We're also looking for any enlarged organs. And so one way to try to see if we can locate it is when we're looking at the liver, is to kind of push up right here. And as you can see, her rib cage is going to pop out right in here. Sometimes when you push in on it, you can feel the tip of the liver come back down and touch the tip of your fingers, and hers is right there. Now we'll come over here to the spleen. And it's another one that's kind of tricky, but the good thing about it is when you are doing that, hopefully you do not feel anything, as that can mean a bad sign. If you can feel the spleen, it means it's enlarged, and hers is not palpable at all. Also, when I was listening, we're also looking for anything like gas and air bubbles, and so to help you with those is you hear like the gurgling, tinkling sounds in the stomach for the bowel sounds. And so the air bubbles is what we're going to hear. It's more of a distinct sound that we can hear if there's something going on in there. A lot of patients, you will hear that in, like if they have reflux or something. With her, I didn't really hear a lot of that. It was just the bowel sounds that I did hear. And so what I'm going to have you do now is, if you will sit up on the side of the bed. And I'm going to walk around to the other side of the table. Just have to lift up the back side of your shirt for me. And so what we look for here is to we have the patient sit up, and we're percussing the costovertebral angles of the kidneys to see if there's any tenderness. And so what we consider that is like right in here. And so what you're going to feel me do is put my hand up against you, and then you're going to feel a thud. Just let me know if that hurts. Okay? Any pain or tenderness there? Nope. Okay, you can go ahead and pull your shirt down. So around her umbilicus and umbilical ring, there was no bulges or masses, no rhotic pulsations, and we talked about the gastric air bubble and the splenic dullness and the liver findings. No bruits were found, no hernias, and other than that, everything else looked and sounded good on her, and that completes my assessment. Thank you.